Investigations in bleeding disorders. This is a huge topic, and then it is more for postgraduate for analysis. But I would like you people to kindly have an idea about it. Now, what will happen is, I would like you to go through the major subheadings. You'll have to go through the history. What is the type of bleeding, whether there is a family history, intake of drugs, etc. And examination. What is the type of bleeding? It is petechiae, purpura, ecchymosis, or hemarthrosis. And do the peripheral smear. Thrombocytopenia, you will be able to diagnose DIC or ITP. Fragmented RBCs, DIC. Defective aggregation, von Willebrand's disease or Glanzmann's disease. Giant platelets, Bernard-Solier syndrome. All this can be MCQs for us. The routine investigations will be the hemogram, that is a complete blood count and peripheral smear. Platelet count, obviously you will have to. Coagulation profile. And in this, you will have to do the PTA, PTT. And these are the things that you people will be reading up. I given a table at the end. I would like you to by heart. Vascular defects will be producing increase in bleeding time. DIC, there will be fibrin degradation products. And this is the way you people do. Those days, bleeding time used to be a question. And there is a method by which we will be performing a bleeding time. There is a BP cuff, and then there is a lancet by which you prick, and it is being blotched off by a blotting paper until the bleeding stops. There are two methods, Duke's method, Ivy's method, template. This is what you do. The principle is given here, and what are the conditions where it can be prolonged. Please go through these. And sometimes you will have to do. Platelet count is obviously important, normal count is given, and where it is reduced. Sometimes we will be having abnormal platelets also. So there can be the other conditions. For example, M3, there can be a thrombocytopenia, and then there can be increase in the leukocyte count. The other features I have already mentioned. Screening test, these are the tests you people will have to go through. Sometimes prothrombin time or APTT is asked as questions. Kindly just brush through them. So I given both. Prothrombin time, activated partial thromboplastin time, both are given. I would like you people to kindly go through. These are all the other things. And this is a particular table that I would like you to buy. For any of these questions, just as in anemia, you can use this master timetable. Von Willebrand's disease, you can use factor 8, factor 9, DAC, ITP. And these are all the list of disorders where it is abnormal I have highlighted. Kindly go through. This is again from my book, 1 page. Thank you for your patient listening. Class 37 is